for the opportunity to be here today and to get to introduce someone who I really enjoy learning from, Dr. Hoda Eldardiry. Dr. Eldardiry is a PhD educated scientist in computer science. Both her PhD and master's came from Purdue University, and she received her bachelor's in computer and systems engineering from Alexandria University in Egypt. Prior to joining Virginia Tech, Hoda led the machine learning research group at Xerox's Palo Alto Research Center. She has a variety of research interests, which include artificial intelligence, machine learning, data mining, statistical relational learning, and social network analysis. She is currently the PI on at least 4 grants funded by the NSF, as well as IARPA and eBay, among others. In 2024 alone, she has received 3 patents, and she has 20 plus to her name across her career. Her publications show her skills in utilizing machine learning and applying that knowledge to many different domains, which include traffic systems, household electricity usage patterns, and specifically for, dear to my heart, healthcare applications. She has written on the ethical use of AI and has contributed to AI governance proposals. One of the things that I personally appreciate the most about her research focus is her interest in multi-source and interconnected data. And as someone working in healthcare, this is a critical aspect of our day-to-day lives, requiring complex computational skills. And Dr. Eldardiry has built her career around exploring these kind of very complex data models. In short, she is an absolute powerhouse. I had the good fortune of meeting Dr. Eldardiry at a Policy Plus Policy Symposium last year, I believe, on governance of new and emerging technologies. And just listening to her, I learned so much kind of about the broader world and the impact of AI from a governance structure. And so it is truly my honor to be able to introduce her today. And thank you so much for being here, Hoda, and we're excited to hear your talk today.
Thanks so much. I appreciate it, Sarah. I'm very happy to be here. Do you all see just the presenter mode? Because I have like the camera on one computer screen.
Looks great. Mm-hmm.
Okay, and I cannot see the video, so I'm not gonna get distracted by that. All right, so let's see. Click. Okay, now it's working. So today I'm going to try and give this talk in very simple terms and just take you through the process of when I think about a research problem, how I approach it, and then I'll use healthcare as the context for this presentation. And then I'll get into a few example projects that I've worked on, and then some ethical concerns and how to really start thinking about different aspects of solving problems in healthcare using AI the right way. And that will involve figuring out what that right way is, or how to start talking about it. So I'll start with the research approach. Basically, this summarizes my life at work, at least. So whenever I start thinking about a problem, I consider my knowledge in that left bottom corner. And then I think it is really, really important to speak to the subject matter expert in whatever problem domain we're exploring. So if it's basically something that is like clinical, then we need to speak to experts in the field that we're exploring the problem within. But outside of healthcare, the same applies. It's really important to understand the problem from the perspective of people that know most about it. They know the challenges, so they can inform kind of the part of the definition of what is really needed, and then what kind of data could possibly be gathered or shared And then from my point of view, after understanding kind of the what is needed part, I start to think about, all right, what kind of ML approaches are out there that are suitable to work on this specific type of data, and then also to address these challenges, limitations, open problems in the what is needed part that comes from the problem domain expert. And then we figure out possible approaches to start exploring for this problem. So this is kind of like the general approach, whether it is related to healthcare or not. So I'm going to go over a few example projects where I use ML in healthcare, and I'll just have a slide on each, and I'll probably get into like 6 example projects. So first one is a project that was funded by iThrive. And in this case, the clinical knowledge that we started exploring was that there is typically a lot of waste in the operating room due to equipment or instruments that are prepared so that they can be used, but then they end up not being used. And the idea was, how do we leverage data-driven learning to reduce unused instruments, that waste of prepping instruments unnecessarily without compromising quality of healthcare delivery, I guess, in this case. And so we started thinking about what kind of data sets can be available, and the type of data in this particular case ended up being videos of the operating room with like actual day-to-day things happening, right? And the idea was that if we are able to detect objects in videos with the level of accuracy to identify what type of instrument is being used, so understanding instrument usage patterns, if we are able to train models to recognize that and infer kind of usage patterns, then we can, prior to procedures, perhaps predict with a sufficient level of certainty what instruments should be prepped and what may not be necessary to be prepped so that we reduce waste. So this is an example of, experts in the field speak with ML scientists, and then we explore kind of the overlap between what is needed, what is possible to identify how to approach the problem. And I'm happy to receive questions during or after, so feel free to comment at any point. Another example is an NSF project that I collaborate with a startup. So the founder of this startup has lost a young family member because they come from a refugee family that had little English experience. And due to miscommunication, because of the language barrier, at the ER admission, the mother was not able to accurately communicate the severity of the incident. And therefore, the medical team did not treat the incident with the level of urgency that was necessary due to that miscommunication. And so this startup CEO decided to start her own company, really, to try and help address ER risk assessment by trying as much as possible to reduce communication barriers by basically developing an interface that could complement verbal communication with visual aids, so that if people have communication barriers due to language or any other challenges, that should not translate into unequal access to like varying levels of healthcare quality. So we started the collaboration a few years ago with an NSF phase 1 funding, and we are currently in contract signing for phase 2, which is awesome. And I am very happy to be able to support the startup as it kicks off by providing some ML backend to support translating a ton of available data into models that can help us predict, hopefully accurately and in real time, the level of risk associated with ER admissions. Another project I think I worked on started like 2022, funded by the CCI, is basically, it's more of like it falls within the cybersecurity as well as healthcare. Basically, it's involved in the safety when we use neuromodulation devices. And the idea is we need to inject the stimulation to the brain with a very accurate level, right? Like the strength level should be personalized to the specific patient. And that involves a lot of factors. And so the idea here was, if we have images from an anatomy level of the patient's brain, can we learn models? In this case, again, it is deep learning models that can recognize and translate those images by extracting specific visual features and translate those into signals that can then say, here is your safety limit of the strength of the stimulation that you are able to do. And so, of course, as you can obviously tell, I'm not an expert in any of that, but I just view the problem from like my own kind of simplified approach, and I try to translate, all right, what kind of data is available and what can state-of-the-art ML models help us accomplish. Another example is, this is actually a small funded project to explore a larger kind of theme, if you will. And the idea is, in telehealth, the users that interact with the telehealth systems need to be trained to kind of use it optimally, and so that in their interaction with the patient, they can be trusted and they can deliver, again, quality service, quality healthcare in general, right? And so the idea is training professionals to use or interact with these telehealth systems can be tricky And if we are able to gather user experience data that kind of summarizes and captures interactions with the telehealth system, in order to use this data to learn or infer the level of experience that one professional versus the other has, and tailor the training to that experience level, if you will, or perhaps also comfort level or interaction style with the system. And so again, it is an opportunity if we are able to gather the right type of data and understanding what is possible, for example, by building an AI system that is able to handle those interactions and adapt the training program to the individual under training, with the hopes to deliver kind of equal quality of training to various professionals. Again, this is still under development to like a bigger grant, if you will, but as an idea, we're super passionate about how do we train healthcare professionals to interact with like complex systems in general, and that should not only be limited to telehealth systems. Before I joined academia, I worked for the Xerox Innovation Group. So we were doing basically for Xerox Healthcare, we were basically trying to generate different healthcare services that could reduce cost in different domains. And I think this presentation, I'm gonna provide two examples in that context. So the first one is one very common scenario that happens to patients of with different challenges is after they are in the hospital or they are in a medical appointment, they go home and they are expected to manage their condition on their own. And they don't really have the medical knowledge to understand specific symptoms. At the same time, the clinicians have that knowledge, but they are very limited to observing these patients only during the limited time of interaction. And therefore, we have a patient who's well aware of what's going on, but don't know how to translate that. And then doctors who really understand their specialty, but don't observe that patient throughout longer periods of time to like really see everything that's happening. And so I actually thought about this idea of how do we bridge that gap in a context that is more general than just panic disorder. But here's just an example. So let's say a panic disorder patient has a specific regimen that they know would help them if they are about to be exposed to like a high level of stress. Can we leverage data and be able to recommend to the specific population of patients, with panic disorder, and say, hey, this is not a really good time to drive. You might want to do your deep breathing exercises for a few minutes before you hit the road. Or any other situations where we are basically leveraging AI technology that learns from data to assist patients manage their conditions. So building in this clinical knowledge into an app or a program that can take this continuum of patient observations or patient state and be able to like use that knowledge, process it, come back to this patient with a recommendation or a suggestion, and help that patient manage their condition. And also, it would be very useful if this continuum of data is then processed, summarized, and communicated back to the clinician so that we kind of bridge that gap between the full observation and the more comprehensive knowledge. So again, this is one example. Another example is we learned from auditors in the healthcare space that there are billions of dollars wasted every year on fraud, waste, and abuse. And the idea was that the way those auditors used to try and address the problem of fraud was very manual, and it was very expensive for an auditor to go out and audit a provider. And so we wanted to make sure that when we flag a provider as suspicious, and it doesn't necessarily, it's not limited to fraud, it could be waste, like it could be mistakes that are avoidable, unintentional, but just need to be identified and educated about or trained. And so we had access to a ton of medical claim data. And the idea was, can we automate the process of going through this super rich collection of information and identify patterns that can educate auditors on what claims could use some additional training or identify as there's an error somehow. And so we could basically leverage multi-source, as Sarah mentioned, anomaly detection so that we can say, this pharmacy is billing for controlled substance more than the average, and then be able to distinguish false positives by saying, oh, but this pharmacy is in the same building as the hospital, and so it is okay for the billing amount to be above average because it has such a high traffic, right? And so it was really important for us to generate a list of providers that our algorithms flagged as suspicious, but also was super important and critical to explain why and how our algorithms flag them so that the auditor experts can come back and say and explain away certain flags, and therefore take that feedback to the algorithm and then correct these assumptions of what is a predictive feature of suspicion and what is explained away given the subject matter expertise. And so with all of these examples, I not only learned a whole lot, but there started to have conversations about, all right, I teach AI, and my students, when they graduate, they will be AI professionals. And from everything we're learning about with the popularity of using AI, there are a ton of ethical concerns that come up. And it is really important, and is, I think, a responsibility of anyone who works in the field of AI to understand implications of problems that they approach, and then try to make sure we come up with well-defined, concrete strategies that we all ought to follow, so that we know that like, it's not enough to focus on solving the problem, but also to understand the bigger context and the implications of developing such solutions. And so, again, this applies to other domains, not just healthcare, but there is the field of research of healthcare ethics, right? All the laws concerned. And then there is AI and ethics. And then when you develop solutions that embed AI in healthcare, now you have another set, or an overlapping, perhaps, ethical concerns. And in any of these spaces, one needs to think about, at least, so this is not a comprehensive list whatsoever, what are the policies? How do you govern certain regulations? How do you train professionals? Who are your stakeholders that need to be trained? How do you embed this, these conversations and these trainings, even not at the training like of professional levels, but also embedded into the education of healthcare professionals or AI professionals. And so I recently won a grant that is like getting started as we speak, from NSF. And that includes the intersection of ethics and AI and education. And so what we're trying to do in this grant is, we're basically saying, if we start to think about how AI professionals address whatever ethical concerns they have knowledge about, and how does that translate into their AI practice. And so this is just the beginning of this research direction. And I'm just going to give one simple example of what I mean by ethics in like healthcare AI solutions. So the first example is, the one example I'm going to talk about today is bias. And if we start to think about using AI in healthcare, there are at least two stages. One is in the AI lab, when we're developing a solution for healthcare. The other one is in the healthcare environment, where this AI solution is being used. And we need to kind of break down what could happen. And after that understanding, we can then start to think about how do we develop the policy, the control, the training, the education? How do we even identify what is needed to kind of minimize or mitigate what could go wrong? And so I'm going to go over 4 examples out of those 6 that I mentioned, just to show what can go wrong if we do not think about these ethical considerations, if you will, and just continue to be like hyper focused on the technology development and solving the problem. So if there are like different sources of where bias can be introduced, and I'll summarize again, I'm not claiming that it's comprehensive, but it's just some ideas. So we can have bias prediction, right? If our model is trained on videos of a specific surgical setting or operating room setting, then we might have bias predictions and then inaccurate expectation of what might happen in the OR. And therefore, if we count on this AI solution, then we could compromise the surgery outcome. Again, this is like a really complex problem, and I'm just like super simplifying it just to get the point across. So keep that in mind. So also, we could have a biased risk prediction. So that project started because sometimes you're able to collect the data at the right time, the right quality, capture it, feed it, process it, make decisions based on it. But then if we do not standardize a methodological way of capturing what happens upon admission and translating this in a very consistent manner, then we are risking bias across different incidents, if you will. And therefore, there will be like uneven risk that needs to be managed in like medical outcomes. Also, if our models in this project are not personalized and we're just learning like a general framework, that is like, because part of the power of ML algorithms is being able to generalize across like wider populations, right? But we also need to kind of balance things out between, oh, this is a very powerful model. It can generalize across populations, but we actually need a super specific model for that very brain so that we do not compromise safety, right? So again, there is a trade-off. There's always a trade-off, and there's actually always a bunch of trade-offs. So we have to like understand what is the priority in each case. And again, the key idea of personalized training is making sure that there is like consistent, equal quality access, and there's not like an underserved population, and so on. And so I spoke about healthcare, identifying what is needed, and then from the AI perspective, what is possible, coming up with a solution, and then started to raise flags of, here are some ethical concerns that one should at least consider, right? And explore. And then I gave examples with the projects that I went over with what can go wrong if we don't pay attention to ethical concerns when we are developing those AI solutions. And so I wanted to break it down more, again, as an example, to get us thinking about how do we define and break down these ethical concerns given our limited knowledge in the various domains that we're not experts in. So when could bias be introduced? And again, bias is just an example here. So again, I spoke about the AI lab. So during the technology development and then during the technology deployment. And what happens is if I build an algorithm to make predictions in a healthcare clinical setting, and I am making specific assumptions based on my understanding, and also I could be making assumptions about the environment or the scenario in which my AI solution is going to be deployed. Now, if this AI solution gets traction because it's a success, and then it's deployed in more scenarios than what I had in mind when I built it, then we have assumption violations of what this model is trying to predict based on, and therefore now it is being used in a different context than it was developed for. And so it is really important to be super clear about the scope of which you're developing a solution, within which. So we talked here about when and how bias could show up. And then now we can break it down even further by thinking about what type of bias could exist in an AI solution in the healthcare context. Or actually, I think this list applies in any context. So knowledge bias, right? I might think that I know everything about allergies, and I don't speak with an allergy specialist when I am building an AI algorithm. Or I could misunderstand things and then build into my algorithm information that I expect to be predictors of certain outcomes. But again, there is a bias in the knowledge of the translation between the real world problem and the AI algorithmic spec design, if you will. Contextual bias, so I talked about this, let's say, automated vehicle is designed to be used to deliver boxes within a factory place, a manufacturing facility. And then they like it so much, they put it on the road, right? Well, it wasn't designed to address the level of risk on the road. It was just designed with the limited scope to be used in the context of a manufacturing facility, right? So that is important to consider, the context. Population bias. Well, if I train my model on a data set that is not representative of the population that this model is going to be used for prediction, then that's a problem. Training bias. We could have noisy data. We could have problems in during training the models on the available data sets. And then temporal bias is when things hold now, but they don't stay the same and change over time. So one example of designing AI solutions that make it easier to identify these sources of bias is to try and design models that are explainable, that are interpretable, easy to understand, so that the expert can see what the model learned and kind of verify that it learned the right thing, right? Also, for all these different types of bias that could be introduced, what kind of models can we design? What are the characteristics of models that would address or minimize each of these types of bias? So for example, if I want to minimize knowledge bias, I can design my AI solution in such a way that it is interactive. And by that, I mean, it is not a black box off the shelf ML technique that is kind of trained on a data set and just provided to our user. Maybe it can also be explainable, and it could accept feedback to refine the model based on the subject matter expert. The subject matter expert can be the doctor that has the knowledge, but it can also be the patient, the user. Like, it depends on like who's the user, who's the expert, and so on. So models that can accept input from like knowledge input. So we can augment the training of the models and not limit it to just the training data, but perhaps also augment it with domain knowledge. Contextual bias, we can build context-aware models where it's not making a single assumption and learning something just for that setting, but it could also incorporate not just the predictive features, but also contextual features, right? So I am predicting that traffic is worst at 5 p.m., but it is heavily raining at 2 p.m. And so now it's not 5, but there will be slower traffic. So it's not only using time as the predictive feature, but it's also incorporating weather. Population bias. So if the data is limited, can we expand our data set such that it can generalize to populations and not be like limited to, again, making this thinking about violation of assumptions during development and versus application, right? Inconsistent assumptions. Talked about training bias. So we want our models to be robust to noise in the training data, missing entries in the data, and then also models that can update. So what if we have a small data set at the time of model development, but at the time of model deployment, there's a continuum of more data being gathered? Can we have these models leverage the newer data so that we can be like up to date with what's going on? So these are example characteristics of models to address each type of bias. And so now that we've defined these model characteristics, how do we learn these models, or how do we train these models? So in the case of wanting to design or build interactive models, we would use human-machine collaborative learning, in which there is always that conversation going on of train it to do this, I'm the expert, and then AI designer goes and trains it, and then the model is explainable or transparent, so the expert can see and be like, no, this doesn't work. This is a good idea. That's not really a good idea, and have that collaboration. to like refine these models as opposed to just black box. This is the expert, this is the AI designer, and they don't talk to each other. Context-aware models, incorporating weather in traffic prediction. You get the idea. So multi-source learning. I'm not, if the problem is about physiological data gathering from a wearable device, and I am seeing an increased heart rate, I should not flag and tell the patient, go to the ER, your heart rate is higher than the acceptable threshold, because I am learning from a different source, not just the wearable device, that this patient just came back from a morning jog. So it's expected for their heart rate to be elevated, actually good. So I don't want that false alarm. And so understanding context is really important. And we can only do that if we allow our algorithm to learn from different sources of data and not focus on the main source of data that is that we think about when we define our problem. And then robustness to data limitations. So can we train on data sets that have very few labeled examples? Also, if we want things to be robust to noise, maybe we can consider, you know, visual, textual, numeric, sensor data, and so on, like different types of data, so that if one source is noisy and my algorithm can handle different types of data, then we can perhaps overcome noise by basically saying, oh, but this is not consistent with that, so this rules this out, and so on. And then models that can adapt to streaming data so that they can update based on new training data that is available. So one more slide is, now that we've identified or talked about, broke down where an example of ethical concerns shows up, now what? So basically, in order for us to translate these identified concerns that could arise in the development of AI solutions in the context of healthcare, it is really important for us to translate those concepts into regulations and also into knowledge that whoever the stakeholders are can be trained, formed into rules, and also education. And so it is really important that we form committees that allow policymakers and AI experts to come together, devise these policies and codes, and also the way I like to describe one strategy that we ought to standardize is, I define it as a two-level translation. One is we have the ethical principle and we want to translate it into a policy. And then we have a policy now and we want to translate it into algorithmic specifics, because we can define concepts that sound like really neat ideas, and the AI developers can be like 100% in agreement, but they don't know how to avoid these issues, right? And prevent them from arising because they can't really pinpoint how does that translate into how I design my algorithm. So the more we go through that exercise of breaking these things down and going through these translations, the more we can kind of standardize, come up with a methodology that makes things clear, so that we can define these policy requirements and make sure they are followed. And the good news is I'm done. Thank you.
Thank you, Hoda. That was really wonderful. Lots to think about in this space. We have a few minutes for questions. Are there questions from the group that folks would like to ask? Mm-hmm.
Hi, Hoda. Alex Podboy. Thank you so much for your talk. I find that often for clinicians or physicians, the research into ML and AI becomes kind of a